Welcome back to another episode of Uncut and Uncensored. And, well, back by popular demand, it's Dr. Garo Kasabian, part 2.
Part 2.
Welcome.
Thank you. Thank you for having me on your show. And welcome to LA.
Well, I mean, I've been here 6 weeks. I actually live in LA now. At this point, it's ridiculous. I don't know when I'm going back, and I'm going to do a podcast about that. But yes, this has been a bit of a weird time. But anyway, since our last podcast, obviously, plastic surgery and beauty is one of our biggest topics. And we had so many questions. And I think we wanted to go a little bit more into depth with different procedures that are available. And I think actually what doctors forget is, because you deal in this all the time, you don't understand that we don't understand, the client, what is possible today. I see it all the time, especially having women's retreats. They ask me, what do you do? How do you do it? How do you stay young? All of these kind of things. So let's head into a different topic, which I thought today we should discuss things like GLP-1, which I think is an amazing tool for weight loss and all of these things. So now suddenly you have a lot of women who've been maybe larger a lot of their lives, and now they've managed to lose the weight, but with sudden weight loss comes something called Ozempic face. And this is something that you see across the board with people that are losing weight. So suddenly, although, some people look fantastic, and although when you lose weight when you're older, the elasticity in your skin is gone, what would you suggest for people like this?
Yeah, Ozempic face is not unique to Ozempic. It happens after significant weight loss, and we've seen it for years with patients who've had bariatric surgery, the weight loss surgeries such as gastric bypass, gastric stapling, the lap band, and so on. We've seen that on their faces. So what it means, what Ozempic face means with the rapid weight loss, you're losing the fat in the fat compartments, and that's those are the ones that give support to the face. As those fat compartments are shrinking, then the face is shrinking also, and you're seeing the face less elastic. So basically, you're going from a grape to a raisin kind of thing. It's shrinking down.
I love that, a grape to a raisin.
Yeah.
I think, we've always, because Dr. Kasabian is triple board certified, and you were a trauma surgeon. So he really does know a lot about the human anatomy, which is what gives most of us so much comfort. And what you used to do back in the day, was all the time before, everyone wanted to do the facelifts again, was the fillers. And I think what we did realize, until everybody got a little overfilled, was that the filler was what gave us that youthful sort of lifted look, which is what everyone wants today and what everyone loves. And I think, although fillers are still an amazing tool, and I still believe that fillers are a great tool to have for any woman up to when they're ready to have a facelift. I think, fillers hold you up for a certain amount of time. I mean, you did mine for what, 10, 15 years?
Yes. I mean, there's a role for everything, and you're right. I've had my full training. I'm board certified in general surgery, beyond that, plastic surgery, and I've done 3 fellowships in cosmetic surgery, specializing in facelifts with the godfathers of facelifts. So I'm lucky to have had that training. And because of that, I can offer the patient who comes in everything, not just one single procedure, but they have options. So a filler is a good option, whether it's filler off the shelf or fat injection, which is also considered a filler. That's a good option to give volume.
Fat injection using your own fat that they harvest from your body, and therefore it's not a foreign body in your face. And a lot of people like fat grafting. It's something I think that feels more natural, that feels, what is the recovery on fat grafting?
Not a lot, but it just requires a trip to the operating room because we need to harvest the fat, which means like liposuction, grab the fat and process it and inject it. And there's a few different ways of injecting it. There's a micro fat grafting, where you're taking the individual like small cells and putting them wherever is needed, like in the under eyes, in the temples, in the hollow of the temples, in the cheeks, lips, nasolabial folds, corner of the mouth, jawline, in the hands, even in the breast, in different parts of the body. So that's very popular. Also, nano fat. Nano fat is like smaller, mo- smaller fat molecules, and basically you're depending on the regenerative properties of the fat in order to improve the quality of the skin. Because some people say they equate fat injection to stem cell injection. Fat injection or nano fat, microfat or nano fat have some rejuvenative properties, because the endothelial cells around the fat cells make the skin look better. How when the blood vessels attach on those fat cells, that process makes the skin glow. So it's a good adjunct. I do it with almost all of my procedures. Even if somebody's getting a rhinoplasty, even on younger patients, where I suggest to do that, like in the under eye and maybe the cheek area, because it not only improves the hollowness under the eyes, but makes the overall result look better, because things are looking more proportional and also more beautiful.
I think, like I'm actually, funny enough, I used to do the fillers in my hands too. And now you have so many options, of how to do that. And my hands have become so much better. You don't have that sort of crepey old skin, which I think after certain age, and also when you lose weight, you have all of that and the veins, and it kind of hides all that, because it used to be that your hands and neck were the bits that kind of gave you away. And now we have so many options. And I think, as again, I've always said, choosing the right surgeon for you, it's not one, shoe fits all. You need to feel comfortable with your surgeon, right? So you need to have a relationship with him, feel that you trust him, and that you have a rapport with him, because, this is one of the biggest journeys you're going to go on. And, again, Kasabian, what I think I loved about you as well was the fact that I have this great thing. If you were a trauma surgeon and you can think on your toes that fast, and then, you must be so well trained to go through something like that. And I think that's something that, just gives everybody a lot of comfort. But also I think, today when you're going under, and I think a lot of people do worry about going under, that you kind of want to be able to do more things at once, right? It used to be that you can only see this guy for the nose and this guy for the breast. And, I think that now it's becoming like, if I'm going under anyway, I kind of want to get the rest done. So, that's another thing that people need to think about. And also, actually, we were talking this morning about facelifts, because a girlfriend of mine just did a facelift with you, and she's over the moon. I'm not going to say who yet, but she will say who it is, and it will come out. I'm very excited, and she's absolutely looking amazing. I have to say,
Thank you.
I went to visit her after 3 days, and I was amazed. I couldn't even tell how, I didn't even see the stitches. It was nuts. But she looks great, and she's going to, obviously she's well known, so she's going to come out herself. I won't out her on this podcast yet. But the fact is, she wants to do as well different things like fat grafting and nose, and not because of anything else, but what I've understood and what I didn't know is that, did you know that the nose gets bigger as you get older?
Well, the nose, well, first of all, you lose just like losing the fat on your face, you lose the fat on your nose. So the cartilages you see them more, you see the irregularities more, and the nose becomes more droopy. And as you're losing the fat on let's say your cheeks, then the nose becomes more prominent. So when it's time to consider facial rejuvenation, and if there's an issue with with the nose, I recommend to the patient, I'm like, for the whole look to be better, we need to address the nose also. That's an option. Same thing with the brow and the eyes. Those are really important, because once you lift the neck up, the cheeks up, then the, you want this part to match the lower part, the upper part to match the lower part.
I mean, it's funny because I was on Jeff Lewis the last 2 weeks, and I think your name was banded around so much. And I know Jeff came to see you, and he came back and he goes, "Well, thanks a lot. Apparently, I need a whole facelift," and that is the truth, which is what I told him, like, because so many people sort of go, "Well, I'll just start here and do a little bit," and my view is, you don't want to look like a patchwork doll.
Right.
And,
what I say, you want the drapes to match the carpet. If
yes,
you're going to remodel the house.
Exactly. What's the point of having a fabulous neck and a terrible face? I mean, I'm sorry to put it like that, but it's true, and sometimes friends ask my opinion. And if you don't want my opinion, then don't ask me, because I'm the wrong person to ask. I just got on with it and I'm over the moon. Everything, works. I mean, would I do a brow lift eventually? Probably, but not yet. But, I think it's really important that, you don't kind of bottle it, as it were. If you've made the decision, and I know it's a hard one and people get so scared, nothing in life is easy, right? But it's actually, again, I would do it again and I feel fine. And I think there's a lot of people, gone are the days. And I think that's where we all come out looking like Catwoman. That just doesn't really happen anymore. And I haven't seen a terrible facelift for a while. I mean, and it's following the doctor again that you like. But
well, although there's like a certain trend now doing with foxy eyes, this, that.
Oh yeah, what do you think of that?
I think it's not it's not for everybody. It's not a natural look. If you want that, like, it's good for a very small percentage of people, and the failures come when certain physicians use it as like a cookie cutter on everybody. And especially I've had consultations from men who had that procedure done and they didn't know they were getting that procedure, and it was driving them absolutely crazy. And there's nothing you can do about it, because once the incision is done and an incision carried out all the way out on the face, you cannot correct that. So you need to individualize each person, analyze them, see what their concern, discuss what their concerns are, and formulate a plan that's going to make them look younger, better, but not different
and fresher. And again, there are little things like the nose, which I didn't know as well, that can be worked on. Also, earlobes. What a big thing. Like, if you're having your face done, you need to probably resize your earlobes. And I didn't think about that till later. And what a difference I feel that even makes. Because as you know, ladies, we all love all these heavy earrings that we all wear. And it's not just about moving the hole anymore. It's about literally taking the whole bottom off your ear, and it just makes it smaller, fresher. And I actually think that's one of my favorite surgeries for women, because
you have many options. One is you're discussing the earlobe reduction, which makes it look more youthful. The other option is very easy when it's, again, you lose the fat on your earlobe, so the earrings don't sit well.
You can put filler.
You can put filler or fat in that area, and that looks fantastic. That's all somebody would need sometimes.
As you get older, sometimes the earlobe can get a little bit wrinkly or lose the fat, and then you can just, within 2 minutes, inject it with fat or filler, and it looks that youthful, plumped up look. But even that, again, eventually, I think, the surgery for that it's super quick, very easy, and something, again, that when you're doing a facelift, you should really look at how everything sits on you. And then also I think what people get worried about is how to the recovery really and what's needed to be done. And I have seen from my facelift and from my girlfriend's facelift, watching it, very little needs to be done. The natural process of healing it's amazing.
Yeah. Well, the important thing is going into the surgery in a healthy state, and we make sure you're not on certain medications that cause bruising, the bleeding, such as aspirin and things like that, and also not excessive drinking beforehand. And then we put you on certain protocols, including arnica and other medications to get you ready.
But arnica and all of these things, it's nothing. It's
The
nothing.
most important is the patients being healthy, and also the surgeon having respect, knowing the anatomy, having respect for the tissues, how the tissues are treated, and in the recovery phase, how the patients looked after. Make sure I use drains. I don't use the netting and other stuff. And the drains work fantastically. Every drop of fluid that comes out in the drain, it means less bruising and less swelling for you. And the drains stay in for a day or two, and then they slide out. And that's why your friend looks great,
She does. And I have to say again, we were out to dinner, I think, I think it was 5 days later, I think, and that's just also, I can't tell you, ladies, I think it's so mental as well. I think you have to be in a good mental space, because that's why I always say to you, trust the journey, trust the process, and trust your doctor, because there's a million doctors out here and everyone's going to have a different opinion. So when you sign with your doctor, it's super important that you listen to him and no one else. And I think that's one of the biggest lessons I've learned. And listen to, if you have a friend that's been, or someone that's been, or you've looked at your doctor's page, just that has to really be what drives you, and you have to just trust that you're going to get there. Because I think there was something very interesting I was told. First you love them, because then you hate them, and then you love them again. And that's really what goes through it. And you will have times where you panic. I don't care who you are. It's just a very natural thing. You think the swelling's never going to go. You're never going to look the same. And suddenly you turn a corner. And
yeah, the healing time is very delicate.
Yeah.
There's a lot of not a lot, but there's some swellings, there's some bruising. And you have to reassure them. And I showed them patients in their 1 day out of the procedure, few days out, a week out, a month out, so that they have an idea what the process is of the healing going to be. And once they go in informed, they're more likely. But still, there's going to be some things where the swelling on one side is more than the other, or the muscles. It takes time sometimes where they're fully active. So in that process, I make sure I'm seeing them very often, and taking care of not only their medical issues but also their emotional and
stability.
mental. Yeah.
So if that's another thing, I think, if I am traveling to see you and I'm staying here and whatever, how is the follow-up done? Like, how am I able to communicate with you or your office? Like, how do I if I suddenly have a panic, what happens?
All of my patients have my personal cell phone number,
Right.
because I don't want something happening without me knowing. That's my ADD personality, but also being, like you said, a trauma surgeon. The advantage of all my training is that I don't want an issue to happen, and like I want to prevent any side effect from happening. But if it happens, I'm there to take care of it.
Well,
take care of it right away.
I think that's the point about being a trauma surgeon. So you're used to making very fast decisions in crazy ways. And I think, going from that to being an artist, which you are for so many years, if somebody wanted to come in, and as I said, maybe someone's traveling to do a facelift, and they want to do other things at the same time. Like, is that because a facelift can be up to 4 to 5 hours?
Yes.
Like, could I do a tummy tuck at the same time, or it's just too much under?
We have to time it. Usually, I like to do the surgical time limited to about 6 hours.
6 hours.
So if it fits within that time, fine. If not, then we'll do it the next day or 2 days after. So we'll pace it like that. I've done a lot of those cases.
You've done a lot, yeah. Okay, and I think sometimes as I said, when you research your doctor and you look at the before and afters, and I think that's the only way you can really gauge it. I mean, nobody knows because you just have to look at the doctor's work, speak a lot to him, have your consultations. And then once you've made your mind up, stick to it. Really just go in with the right mental attitude. I can't tell you, mentality is everything. And every girlfriend I know knows somebody who has a doctor. It's a very personal choice. It really, really is. And that's why I specifically never get involved with my girlfriend's choices either, because I don't want to be the one. Those are things that you have to decide on your own. It's not a group decision. You can only be informed and see who you resonate with, really. So going back to sort of anti-aging now, for women, do you think because the facelift is obviously one part as well, and things that it's just a hot topic right now. Everybody is looking at it. I think this generation is looking for a more natural way to look. Even I think I saw Kylie Jenner dissolved her lip filler yesterday. I think there's still a big room for fillers. I just think the look is different. So again, you can dissolve, you can start again. You don't want to be overly filled. You just, you want little bits just to lift you. I think one of the most effective ones that we used to do back in the day was the temples, bringing the temple out, which also makes you look more youthful.
Correct.
And another way we use filler and always have is in the chest lines. And that's, you guys know, I mean, we've been doing this for quite a long time. It's something I wish I'd started earlier. And I wish I knew more about, because I was so focused on my face and my body, not my boobs, between my boobs. And that my girlfriend even asked me today. And that's one of the things that is you can't really correct that with surgery either.
No, that you need to take care of the skin with rejuvenative procedures, both from the outside and the inside. So what we do from the outside is do microneedling with 7-PDRN. We can also combine that with IPL if there's pigmentation and also or sun damage, and also Morpheus in that area. But from the inside, we've been doing Sculptra for years from the inside. That's a collagen stimulator to bring support underneath it and make the tissues more youthful.
So Sculptra, just so if those of you that don't know, Sculptra is also what he was using in the cheeks and in the jawline too. So that actually is a filler that then tells your body to replenish its own collagen supply. So that is something that we did for quite a while using cannula.
Yes.
Down into, but all of these things take maintenance. It's not a one fix. It's ongoing. And PRP also is a good one for the lines there.
Yes. Here also I've been using the hydrating agent with 7-PDRN injected.
We're doing that
inside,
on Friday.
So that you get that glass skin look on rejuvenate the skin as much as possible.
And that is, I think, one place that we talk about our hands, we talk about our neck, we talk about our face. But again, the chest and going actually just between your breasts is such an important area, ladies. My girlfriend who's younger than me called me this morning saying, oh, I was wearing this silicone patch thing. And she goes, what are you doing? And she goes, I need that. I've got lines in mine as well. And I think, I would just urge women to start a little bit earlier, but don't forget that when you go to, have your faces looked at and filled and things like this, you can work on this at an earlier stage. And I would have done that had I known or thought about it.
Yeah, correct.
What other things?
I mean, now the beauty about plastic surgery or cosmetic surgery is we're at the forefront of medicine, and we're open to introducing new discoveries and whatever we think is going to help the patient look better. So
it's evolving every day. I mean, just the little techniques. And also, by the way, ladies, things like when you do your nose, you don't have to do the whole nose. Sometimes people just want a tip refinement or lift, the edge of your eyebrows. You don't need a giant. I mean, I think so many times we get scared by what the big procedure looks like.
Right. So as far as like surgeries are concerned, we're getting the skin ready with treatments, and especially from the outside with micro needling, with the salmon PDRN, with the IPL more, and then beyond that, during the surgery, besides the fat grafting, nano fat grafting, been using PRP and PRF. The difference between PRF is got the fibrin that makes that lasts longer and also makes the skin look better. So that we're combining it with facelifts, and it's giving excellent results.
And what are you doing for like looking after scars after surgery? Like what do you feel like is best? Because people are so frightened about the scars.
The key about scars is going to a surgeon who prominent scars on the facelift. It has to do with the design of the facelift and where the tension points are. So when I'm doing my facelift technique procedure, I make sure the lifting, that the support, the tension is on the bottom layer, the work that's done on the layer, the deeper layer. And that's gonna be lifting, correcting the neck, lifting the jawline, lifting the corner of the mouth, the jowling, the cheeks, the under eye area, the face. So that's under tension, under support. But the skin, it should be on just the right amount of support, because the support points, that the tension points that I have is up here above the ear and behind the ear. And the rest of it is under no tension. And when you close the skin under no tension, that's when you're not going to have scars. You're going to have and plus the technique of how do you close a scar when you take out the stitches, those are all minor details. But the people get into trouble is when they think they're going to lift up the skin and then cut as much skin as possible and then attach the skin on the ear, thinking that the ear is going to hold up the rest of the face. And the opposite happens, is the face starts dragging the ear down. Then you get these long ears that are called pixie ears. And the scars, they're under so much tension, they become thicker. They're called hypertrophic. Some people call that keloid. They're not really keloid, but they're thicker hypertrophic scars. And then you have to treat them with Kenalog and some other medications. But the real thing is like the design of the surgery has to be done right, so you don't get into that issue.
See, I have I get all different ages approaching me, and I was looking at someone who was quite a lot older the other day, and she was saying to me, I want to do something. Should I, who isn't a candidate anymore? Like, I kind of the ilk, like if you haven't touched yourself to 75 at some point, do you just say, look, a little bit of Botox, because otherwise isn't it too weird to do the whole face, or would you say go for it?
See, the best results in plastic surgery are the people who need it the least. The younger you are, the better you're going to look. Especially beautiful people like you are going to have a fantastic result.
It used to be, they said the other way around, wait all the way to the end. And I kind of feel like I would have used on her more lasers and Botox and just do a little refresh.
Yeah. Well, I had a lady, she was 88 or close to 90. Wow. And she came to me. She was healthy, no medical issues. She's like, this was over 20 years ago. She's like, please, I want to look good for my granddaughter's wedding. Please, can I have a facelift? And I thought about it a lot. And then she's healthy. There was no reason not to do it. And if it's going to make her happy, why not?
Yeah.
She's going to buy a nice dress, wear her nice jewelry.
No.
Why not carry out a fresher face? And she was very, very happy, very thankful. So everything went great and all good.
I think there are just, so many steps today you can take. There are deep lasers now. There are deep facials. There's peels. There's Botox. Depending on how far you want to go, there are so many options, which is so exciting because you don't have to hate the way you look. As soon as you feel good about yourself, I think it reflects in every aspect of your life, no matter what. You've become more successful, your relationships improve, your friendships improve. And that's just down to not because you look better, it's because you feel better inside and out. And I think that's what people think this is so superficial and, oh, she's so into herself and it's just all about this. No, ladies, it's not. It's deeper than that because, once you feel and, like the outside matches the inside, you can really conquer the world. And we're living so much longer these days.
That's why my motto is looking good feels good.
Yeah.
And the opposite is true. Feeling good looks good. When you're feeling good about yourself, you're exuding this confidence and energy, that positive energy that people are attracted
to. I've never felt better. I can't say that I've ever regretted my decision. In fact, I'm a big advocate for it. I think if you're thinking about it and you've been sitting in the mirror and you're doing this more than 3 times, just get on with it. And there's never been a better time to do it, actually. And again, I wish everybody gets the confidence they need to, take the next chapter in their life on by, and it's like investing in anything. Yes, it's expensive. Yes, it's your, but it's your future. And, once you've done that, I believe.
Yeah. This is one thing you don't go price shopping because you're not getting the same item. It's not from one doctor to the other. It's like apples and oranges. It's not the same training. Everybody's saying, I'm doing this procedure, I'm doing the most advanced procedure. Just look at their training. Suddenly everybody's an expert in the very highly specialized procedures that you need expertise and training in. And they don't do that. Or traveling overseas and getting it done. You don't want to risk that. Like there's a lot of people would come back with injuries and stuff like that. So
no, you want the Birkin bag. You want the Birkin bag. Stick to the Birkin bag, and I think it's very, very good advice. It's your face, it's your health, it is your moneymaker. At the end of the day, your body and your health is your moneymaker. If you don't feel good and you don't have the right doctor and, something goes wrong, then, it's, I don't think you can put a price on that.
Yes, correct.
Dr. Kasabian, thank you for coming today again.
Thank you for having me.
And clearing up more questions that everybody has. And I think, it is an ongoing, really exciting topic because I think we've only just scraped the surface really of what's going to be possible.
Right.
Now with longevity and everything else, we're going to be living to about 120, I'm hearing. So, we better look good doing it.
Well, everything's coming together. Like you said, like people are into health. are into more natural look. Thank God you're not seeing those overfilled faces or overfilled bodies. All that
Gone.
is going back to natural look, healthy look. But at the same time, people want to look their best, and the stigma of getting a facelift is gone.
And that's
It's-
one thing that I think we've all done. I feel a big part of that. You know,
when I
think
started my practice here in year 2000, it's been 26 years I've been here in the same clinic. At the time, people didn't want to talk about facelift. Didn't
No,
want to
they
talk
would
about
have-
their scars.
they would have like cars waiting with blacked out and like, you know, the blankets over their head. I do remember seeing all that. Like it was the biggest taboo.
Yeah, and it was more like when I was training with Dr. Canal, who's the father of modern facelift. Before that, in Miami with Dr. Baker and Susan, it was ladies in their 60s and 70s getting facelift done. But when I came back to Beverly Hills, like one of my first clients was 49. She's like, it's my 50th birthday. I'm like, wow, that's. And then a whole bunch of her girlfriends came in, same kind of thing, 49 going into 50, getting facelift done. But now we're doing it younger and younger because
recovery is so much easier.
Recovery is easier. The results are fantastic, and also people are in the workforce and they want to put their best face forward.
Yeah.
You know, where you're on somebody like you're on camera. Other people are on Zoom calls, sales. So, and if
There's
there's
nothing
a
to be
safe
ashamed of.
solution, 1 week, give me 1 week, I'll take
You'll do
10
it.
to 20 years off at least.
I love that. Give me a week. You'll take off 20 years. Amazing. Thank you, Dr. Kasabian. Tell everyone how they can find you if they want to get in touch, if you want to have a consult with Dr. Kasabian.
Sure. I'm Dr. Garo Kasabian. I'm in Beverly Hills. You can call our office +1 310 285 0400 or email us at info@liftmd.com.
liftmd.com.
Yeah, info@liftmd.com.
Thank you. Thank you for
Thank
joining
you.
and
Thank
taking
you.
the time. Thank you for listening to another episode of Uncut and Uncensored. And don't forget to subscribe.